I've got a distinct advantage that, it's something that somebody may look at the records for 2 hours and not know exactly where it's going to be. And, I could flip through them in less than 5 minutes and find the specific page needed on what's at hand.
Right. You're used to looking at these records as a nurse. Absolutely. So is there anything now that you know as an attorney that you wish you knew before when you were a nurse?
Yeah. So I think one of the main things is, as a nurse, you understand kind of nurse governance and nurse regulation in the sense that, that state regulations for nursing state what your practicability is. Your hospital has the policies on what you could do as a nurse, but just kind of having an overall better understanding of the medical field in the system, that the hospital deals with certain regulations. Field of medicine has quite a few regulations that they're contending with that change from year to year. And a lot of the internal changes within the hospital, a lot of the time, are driven by what these regulations are. And the unfortunate thing is, as a bedside nurse, a lot of the times you see the ill effects of these changes without understanding why they're being made. It typically falls on the hospital administrators from the bedside nurse's perspective that they're making these changes and driving them. But a lot of the times those things are driven by what the regulations currently are and how those regulations change year over year.
I have a lot of the medical experts that work with us that, especially when they're first starting out, come and tell me like, wow, I can't believe how this knowledge or this experience learning the legal stuff has changed my clinical practice. And they're kind of surprised by that.
Yeah, no, definitely. And the, just kind of the way it's set up, everything is driven by money and funds. So, if they're not complying with the regulations, then the hospital is not, they're losing money on it and not, being able to afford the right equipment for their patients. So it's kind of understanding that there's a happy medium that's, trying to be found there a lot of the times, and, thinking of creative ways at the bedside to do the best you can with what you've got sometimes is what you've got to do.
Sure. I think too, with the documentation piece, a lot of people in clinical practice that are just medicine, not knowing the legal piece, don't understand the importance of documentation in a chart. It's just like, oh my God, I got to do all this charting now again or whatever for their notes. I think they get a new perspective of what that means, seeing it from a legal perspective.
Yeah, for sure. And certain things that you think may be important aren't as important, and other things that you don't really think of are really important. So
yeah, absolutely.
It is to spend some time on that piece of it, on documentation. If you're, doing anything, it's nice to be able to document, but anytime that there's anything that's out of the ordinary or not typical, you definitely want to document that. And anytime that, there's a change within your patient or within their status, that stuff you certainly want to document. And anytime you would have any variations from a policy or procedure as well, documenting why that was done, if there was any approval that you had to get prior to varying from that stuff is important as well. Because if you're looking at a medical record 2 years after you provided care to a patient, a lot of nurses remember their patient, but the specific intricate details of what went on that day, it's very difficult to remember all of those things. So it's, you want to be able to use the record as, a refresher for yourself as what had occurred and what you did and why you did those types of things. So,
right. So how about for medical people that want to get into this legal work as an expert into the legal community? What kind of advice might you have for somebody trying to do that?
There's definitely ample opportunity in there's a couple of recommendations. Is one is realize your specialty and realize what you could provide within that specific specialty. Two is leverage that specialty and that special knowledge and try to identify or locate somebody who is practicing as an expert or a professional in that area to launch your opportunities and your knowledge going forward.